My name is Lwasampija Baker, and I'm here to tell you about our research project. So HIV prevention services in Uganda, including pre-exposure prophylaxis, are largely donor-funded. And with the current health financing trends, we see that this is not sustainable. So we set up to create a machine learning model that uses publicly available data sets to be able to predict individuals that would be willing to pay for such a service. Our intervention is really to help profile and segment individuals who are willing to pay. And it would be very helpful for implementing partners like the Ministry of Health and other organizations and businesses in health to help profile and make this important business decision on when and where to implement these kind of services based on what the information our model gives them. To make sure it is inclusive and remove biases from our data, we use both publicly available and private data sets. So with the public data sets, we use the Uganda Health Demographic Health Survey and the Uganda HIV Impact Assessment Survey for our data. And then we supplemented this with in-house data from our Rocket Health Clinic to make sure that at least we have representation from all demographics. So we had to come up with creative ways on how to merge these diverse data sets and come up with the central and combined data sets that we use to train our machine learning model. Now, we trained our data sets, our model on an ensemble of machine learning classification algorithms, and we looked at things like recall, precision, and accuracy of the model. And from the training, AdaBoost came out as the most proficient model in terms of predictability, performance.
Hi, my name is Nasamla Rachel. We have developed an AI model using predictive variables that are commonly available in many countries' health demographic surveys. For this, we believe that this will be able to fit into many countries' contexts. This model does not only predict one's ability to pay for PrEP, but also locates these individuals on the map. So we have developed a geo map locating all these people across the country.
We had some challenges implementing these projects, and most of them were associated with data collection processes. We had a very lengthy IRB approval process, which ate into the project's implementation time. Then we had problems merging the data sets because they were extremely diverse. We had to be creative around that. And then finally cleaning the data because some of the data was missing or was incomplete in the way it was filled. So we learned a lot during the implementation of this project. And one of the things we learned was really how do we access data and how do we clean diverse data sets and merging them. And then the other things we learned how to collaborate and ask for help from other partners who were doing similar work. So the whole exercise was really a very good learning moment for us.
On the next steps, we have written a paper which we are about to publish. And also, we intend to carry out a follow-up study about the validation of our model. We intend to collect new data and validate our model on this new data, surveying the prices of PrEP to understand how much people can pay. We have benefited a lot from being part of the HASH network because this has enabled us collaborate and share knowledge with other researchers and experts, especially in the field of AI and healthcare. This network has also facilitated opportunities for feedback and validation of the project's methodologies and findings, which has been so beneficial to our work. We've also benefited from the increased exposure and wider dissemination of our results. This increased visibility may attract attention from potential partners and collaborators, which may foster future research endeavors.